And you show your figures now.
Okay, all right. So remember, so wherever you are, you gotta look good, right? Whatever weight you're at, you gotta look good, right? Because if you don't love yourself where you are, you might as well not lose the weight because you won't love yourself then either. Okay? So wherever you are, love yourself. So that means picking out things that make you feel good, right? Doing your hair and nails to make you feel good. Or hey, and if you don't even like nail polish, at least clean them. And, you know, brush your teeth, floss, see the dentist, get your hair done, you know.
Why you come with that for the whole people? All people know to do that. We are seniors. We know to do that.
Okay, I beg to differ. We got somebody in the back that says if we're a senior, we already know how to brush our teeth, comb our hair, and take care of our nails. Not true. I'm the doctor, you forget. I've seen the feet. I've seen the feet. Okay? A lot of people soap from here to here. And don't go past the knees. Okay? So, and sometimes it's difficult. You can't bend that far, you know, and it's hard to get it all the way up. So treat yourself to a pedicure once a month. Take care of the feet. And I'll give you more reasons than cosmetics. The feet, especially if you're diabetic or have vascular disease, circulation problems, can be a source of illness. When your feet, you can step on something you're not aware of, get a puncture in your feet, and send an infection into your body. So take care of your feet. It's really important, not just for cosmetics. And if your legs are sore, if you get a good person who does a good pedicure, they massage those calves and those ankles, and it feels amazing, you know. So take care of yourself. Take care of yourself. So today, I'm going to get started on a subject that, join me on Zoom tonight at 6 o'clock, where we will continue discussing healthy tips for weight loss, right? Some really good healthy tips for weight loss. But today, it came to me that we need to have a conversation about something really, really important, okay? And I want to know, why do I care? Why do I care? About anything. Why do I care what people think? I have to ask it. Why do I care what people think? And why do I bring this up? I often give advice about weight loss, healthy tips about eating, tips about just being well. And then I get this pushback. My family won't like that kind of food. Oh, they don't eat rabbit food. I'm gonna have to put two plates. I'm gonna have to make 2 meals because they're not gonna want to eat that. So I ask the question, talk to me. Why do you care? Oh, look at her, she's wearing that skirt. It's so high above her knees. Why do you care? Why do you care? And let's have a conversation. Why are we caring? You cut off your hair and it was down to here. Or you won't cut it, because if you cut it, people are going to talk. Or you don't pick the color you really want, that nice, beautiful blue, red, or blue, because people are going to talk. People are going to talk. So I need us to answer that question. Why do we care? And you really should answer it, because it's preventing you from doing some things, even going some places.
For me, I don't care. And the reason for me not caring, I heard somebody was telling me this week that I don't heed this, I don't heed that, I don't heed this. I said, that has nothing to do with me. That's about you. I heed what I want to eat, you eat what you want to eat.
Okay.
So I just don't care about what people says.
So we're going to break this into healthy caring and unhealthy caring. I'm always talking about health. So she made a comment that someone was saying about food. Well, I don't eat this and I don't eat that. And she said, well, I do. Because, you know, there are a lot of people, let's take pork for instance. There's some people, I don't eat pork. Pork is this, pork is that. And then some people do. And some people won't eat pork around certain people because they know that person doesn't eat pork. So they, yes.
And the reason why that person eats processed meat.
So you got the processed meat. Then there are people with processed meat. I don't eat processed meat.
And I said, I don't eat processed meat. I don't eat it.
So, does anyone struggle with this at all? Yes.
Okay, why do I care? My daughter tell me, "Oh, why you care? Why do you care about that?" And I say, "Cause I'm concerned about you. I want you to, you know, I want you to be with me longer, and I want to be with you longer. So, it's a matter of love."
Okay, so we say love. So we say we will care because we may love. We may love. Out of love, we're going to care. Give me an example of something your daughter says to you. Mom, why do you care? Give me an example if you can think of it.
Well, like for example, we all kind of overweight, so I was telling her about I had lost a few pounds and what I did, you know, cutting down on the sugar and all that. And she loves rice, and I said, why do you have to have rice with every meal? And then she says, well, you care about what I eat, and I says, because it's full of, you know, it's harmful to you. You don't need it.
Okay, this is we're getting hot now. We're getting
Yes,
hot, right? You feel the heat.
Yes, right.
Okay, we feel the heat. This is a wonderful example. So, you've decided that you are going to lose weight, right? You made that decision. You decided to decrease your starches and your sugars and things that are processed, right? Which are wonderful things to do if you're trying to lose weight.
Yes.
But then you turn to your daughter, and what did you do?
Well, I try to encourage her to get on the same bandwagon because we all kind of overweight.
Okay. And so with love, we're talking about the love. You've decided to share your weight loss goals, right? Out of love. And you're doing it because you care and you love her. But somebody help her. What is she actually doing?
Well, I think that's, well, I'm gonna use this word, aggravating, because one thing, I'm gonna tell you why, because my husband decided that he wanted to have veggies and meat only, no starch. So you know what, I did it with him for years, but then he started cheating outside. So then what I did is I started fixing what I want, and you eat the meat and veggies, but I'm gonna eat mac and cheese, I'm gonna eat some rice, I'm gonna eat this, because you cannot convince somebody, because they're doing something, to do what you do.
Okay.
That is true.
Okay. I get it. I get the love. We never want to see the people we love in pain, right?
Right.
We never want to see the people we love in pain, especially our children. Nor do we want them to get on the track of destruction, right?
Yeah.
When we see the train coming, they're eating poison, they may be smoking, they may be drinking, they may be hanging out with people that they shouldn't be hanging out, right? And out of care, stemming from love, we then step to them. And we then want to give to them the advice that we're certain they don't know. That they are certain that they don't know that eating processed food is going to not be good for them in the long run. That eating too much food is not going to be good for them. They don't know that. Say it again.
They know it.
Okay. The truth is, do grown folks know the right thing?
No, not everybody. Not hard.
Most of the time.
Not hard.
Not perfect.
I got yes and no here.
Not hard.
Sometimes no.
Not hard.
Most of the times,
That's what I say.
okay.
Well, I'll tell you what, I know a lot, but I don't know everything.
That's
But I
true.
do know a lot.
But for the basic health tips, The basic things for health. Do most adults know?
Yeah.
If you're diabetic, tell the truth. Do you know you should not have sugar? Yes, the average diabetic person knows they should not be having sugar. They do. Because when they have sugar, their blood sugar goes higher. Tell me if the average person with high blood pressure does not know they should not be consuming salty foods. Okay. Do you know it or you don't know it? Okay. Does the average person know that they should have some exercise daily or movement or activity?
Yes.
We know this.
Yes.
So, yeah.
But are we doing it?
But sometimes we don't do it.
That's right.
Now, looking in from the outside, mommy, you know, I'm a mommy too. Out of love, we jump into their other business. And we try to give them information and advice. Let's call it what it is. Let me make my 2 cents. You give your 2 cents to grown folks. And then you get your feelings hurt.
That's true.
You get your feelings hurt.
Of course, yes.
Because then they're going to say things to you like, I'm not you. If that's what you want to do,
That's
you
right.
do that.
That's right.
And then your feelings hurt. But I'm only trying to tell you, you know, because I love you and I care about you. But I like this. I like eating my pork. I like my ribs. I like my mac and cheese. Okay? You do you.
I like my pieces.
And I do me. Okay?
Yes.
But out of love, do we come back? So we wait a week or two. You don't want to go exercising with me? Yes, my love.
Well, my son is a hypocrite.
Call him out. She calling him out. She said her son is a hypocrite.
My son is 36 years old.
Yes.
And when I was 36, I was fine as wine.
Mhm.
Now you can't compare, and he is out of shape.
Okay.
So he trying to tell me what I can't eat and what I should eat, and I'm looking at him. And then he's a baker. He likes to bake chocolate chip cookies. Homeboy have chocolate chip cookies sometimes for breakfast.
Okay.
I said, well, how you gonna tell me what I'm supposed to do? I said, you see his pictures? Because I look at my pictures and get jealous of myself.
All right. I like that. Hey, dig up those pictures. Let's get jealous
That's
too.
a
Okay.
motivation for me to try to get back to that.
Right.
But don't be telling me something you're not doing yourself.
Okay.
So that I don't like, you know, and I know I'm a diabetic and I do cheat.
Right.
So I try to do things in moderation. I exercise, I walk, whatever, not all the time, but I try to do things in moderation. But I'm gonna enjoy my life. I'm
Okay.
gonna enjoy what I like to do.
I love that.
But my son need to be here because he get on my nerves.
So this love.
I ain't no love. Who's trying to be my daddy or who?
So now
That's true.
we take this love that we're trying to give, but we feel it causes a feeling of what? He getting on your nerves. He's a hypocrite.
No, when I was his age,
Right?
I ain't had no weight problem, no nothing.
What
I think
else?
I'm doing pretty good at this age, at 67. So
Okay. So they get on your nerves. They're in your business.
Cause
Right?
you
Boss you
stress.
around, you feel all these things, right? When people start telling you stuff,
Cause you to be stressed.
stress you. They're trying to stress you out.
yeah, that's what he doing.
But they care. They care. They're loving on you. Right? They're loving.
Wrong love.
You know what my kids do? They reverse the role.
Uh-oh.
Yeah.
They think they can be my parent
Thank you.
and tell me what to do. You know?
I love you.
Yes, of course. But I don't need that. I'm knowledgeable.
Okay, okay. So what kind of give something where they are showing that they care,
Uh-huh.
but you feel like they're trying to parent you.
My weight.
So they talk about your weight.
Right.
Okay. So what kind of thing what do they say to you when they're parenting you?
they said, Mommy, you need to get out, do more exercise.
Okay.
Don't eat so much of this, that, and the other. I said, look, I know what I'm doing, I'm grown. I raised you, you can't raise me. You know?
Okay. So I brought this subject up because we see when other people are doing it to us,
Yes.
right? Our vision's very clear.
Amen.
You're bossing me around, you're trying to tell me how to be, you're trying to tell me what to do. Even when we pay people to tell us this stuff. I'm serious, I'm a doctor. People actually are paying me to tell them how to control their blood pressure, their diabetes, lose weight, get rid of an infection. They're paying me. And when I tell them, they tell me things like, I know what to do, Dr. Powell. In fact, I already took my honey, my lemon tea, and I'm drinking my Cersei tea. This infection will be gone. But you just walked in and you asked me what to do. You know? I mean, even getting paid.
Tell them and they're not listening.
You know? So, like you said, it kind of seemed, it's got me kind of confused. So I have to ask the question, why do we care? Why do we care? So when it turns on us, Mom, I need you to lose weight. Daughter, I need you to get on my bandwagon and start eating right. You know? Or you need to get out and start walking. Or how about your medicines? You didn't take your medicine. Did you take your medicine today?
Yeah.
Why didn't you take your medicine today? Have you had that? Kids ask about your medications, things like that.
And they're concerned about your time.
Oh, your time. Did you go to bed? How long you been up? You been up. You didn't sleep last night. I knew you were up.
That's right.
I could hear you. You were up. You ever had that?
Yes, Mom, where are you?
Where were you?
I called you and you come to your house and not here. Where are you?
Care. Caring and love, they're going together. But I want to move over, as you know, I always try to give something that will be helpful. Because we don't want to stay in the same old behavior, because the same old is not progressing us. Nor are we we're not getting anywhere. We're repeating ourselves. You ever repeat yourself over and over again?
Yes.
Thinking you're going to change something?
Yes.
Okay.
Yes.
So I want to show you that there's a difference between healthy caring and unhealthy caring. Okay? You can love someone and let them be grown. In fact, you should love and let go.
Yeah.
Love, but let go. Because for grown people, you get resentment.
Yes.
You get people thinking you're bossy.
Yes.
And it's not that you're trying to be any of these things, you're just trying to give love.
Go ahead.
Healthy. When you're asked, and people don't ask you for information, don't give it.
Oh, yeah.
Stop giving pearls to swines.
All right now.
Okay?
Come on now.
Stop dropping the science to the book illiterate. Okay? Or the unmotivated. Remember, when someone is not motivated, it doesn't matter if you give them gold. They will not receive it. So first thing you want to do is wait to be asked. I know it's hard. You see the people you love tripping, and you want to tell them, you do know there's a hole right here. I see it. But they step in the hole again. And you come back and you're like, there's a hole. You know? It's the same thing. You know, if you keep smoking, you're going to end up with COPD. Your uncle got COPD. You're going to end up with COPD if you keep smoking. You don't want COPD. I'm telling you, you got that coughing. See, you're already coughing. Look at you, already coughing every single morning. I don't want to hear that.
She has a question.
You know?
Can I?
Yes,
just
my
wanna,
love, please, of
just
course.
Say something. You know what? We as people, we don't understand that we are our biggest advocate. And to be a great advocate to someone else, sometimes we